So then they came to be faculty after they served their 20-something plus years, and they're excellent, yeah.
I really enjoy hearing from you about other individuals, or about the individuals, the deans and the faculty who have an impact on you in terms of the nursing program. But I'm going to ask, how has the College of Nursing changed and evolved over the years? What are some of the school's primary innovations and strengths?
It's a very interesting comment. So, like I said, Jane Swart, one of the things, even though she wanted to expand, she did expand our graduate program as a dean. And so we are very, under Gert Torres, we did start our first master's initiative, which was a degree in community health nursing. And then we added a master's in nursing education, a master's in nursing administration. And when Gert came, was kind of the major nurse practitioner movement. So with Margaret Clark Graham, at the time they wrote several federal grants to start the family nurse practitioner program here, which at one time I really do feel it was like nationally ranked. We actually, in U.S. World Report, as far as an online program, it was ranked way up higher than Ohio State.
Do we still have that program?
We still have the family nurse practitioner program. That's probably one of the most popular. And then Dr. Curry2 came, and whose background was critical care, and she started our acute care, and I think they've added gero to the words of that. So it's an acute care gerontology nurse practitioner program, and that program is nationally recognized. They have, the last check, they still have 100% pass rate on their certification exam. It's such a rigorous program, and Dr. Scordo is begged to be, she's invited to speak all around the country and actually serve as a consultant to places where they've started other acute care nurse practitioner programs. If you went to Ohio State or Miami Valley, actually when I walk into my cardiology practice, the nurse practitioner that sees me is a Wright State graduate from Chris's program.
Well, I'm glad you mentioned these, because we do have innovations and we do have strengths that are known.
Yeah. Oh, yeah.
Nationally, if not do we have any international connections?
Well, we've done some international initiatives, but again, all of the deans from Pat Martin through Rosalie Manus have tried to be connected with other universities, like the university as a whole. I set up a collaborative relationship with Universidad Desarrollo in Santiago, Chile. So we had students from there come from, in England, University of, I'm going to go blank on it. Oh, it's terrible. An English university, Central Lancashire. And they've sent students here for experiences, and we've sent a student there. We've done an exchange of students. And then Ubei University in China, we've brought over 2 or 3 of visiting professors from there. Unfortunately, not many of our faculty want to go and live in a place where very few people speak that much English, and it's kind of like, we have not anybody that wanted to go over there. And of course, right now with the finances and stuff. But then what's really outstanding is Dr. Rosemary Eustace. Her and her husband are both originally from Tanzania. And Rosemary did her master's in community nursing with us. And Rosemary takes students every year to Tanzania for a global health program where they'll go out and work with the clinics, and they'll visit the hospitals and the initiatives in orphanages there. And whenever you have a time to listen to her stories, you'll find it fascinating that it is a whole different world. I've gone over with her, and we've had other faculty that have gone over, as well as many of our students. So I take students to the UK, but the UK is very civilized. Mm-hmm. But their healthcare system is so radically different, and that's what I educate them on, is this is the pros and the cons of socialized healthcare. So.
That's very interesting. Listen, I'd like to ask you a few general questions about Wright State. Okay. Not specifically nursing, but just kind of general to move toward the end of this interview. So many long part-time faculty and staff has such a strong connection and fond memories of Wright State, the highs and the lows
Oh, yeah.
and all of that. What do you think makes Wright State distinctive and special to so many people?
To so many people. I think for many of us, it was a place of opportunity. If you came and you wanted to do something, we had so many initiatives from the Research Council would have these research incentive grants. The different provosts' office would have these initiatives. I'm not sure, you were at more like liberal arts. I'm not sure if they had similar kinds of things, but if you wanted to get seed money to start programs or to start a program of research, you could do it. And the Dayton area, the community has always wanted to collaborate on things. You know, we did the Center for, what is it called? I'm going to go blank on it. Through the School of Medicine, but it was also through nursing, and with Sinclair, we had a partners, community partners. Oh gosh, I really apologize. I can't remember the exact name of the program, but you know, where we all collaborated. And it's through them and an initiative that I wrote with a group of people. I had a $1.5 million grant through the Department of Education to work with educators and school nurses in the Dayton Public Schools to integrate health, meaning health promotional content, through their whole curriculum. Again, that integrated curriculum piece. So, for example, want to learn about temperature, how to manage a fever. Well, let's put that in science or math where we're talking about thermometers and converting centigrades to Fahrenheit. So, you know, you're using math principles. That kids have to learn the math. Oh, by the way, indirectly they're learning about fever management, which everybody as should know how to do as far in your own home, and obviously nutrition, counting calories. And so we had all this curriculum that I didn't write. A person in the Dayton Public Schools had written this curriculum, but I had the grant to help educate all of the faculty, and I made them give me lesson plans for an entire year. Where are you going to integrate all of this into your curriculum?
Yeah.
And we also gave them huge boxes, again, the money from the federal grant, of resources to teach, you know, like models of the brain and stuff like that. So,
I think you're right in terms of collaboration through in the beginning years and onward. In our work with arts and disabilities, we worked with the Office of Handicapped Disabled Services and Nursing and Education, and that's what made it really interesting.
Right.
Listen, in your opinion, Donna, how has Wright State changed over the years, both positive and even some negatives, if you want to throw this out?
Oh, you really want me to get going? So there's been several changes. One of the changes from a faculty perspective was the evolution of the union, the AAUP here. I am not a union lover. I can sit and give you chapter and verse while unions have their place in time, and we don't need them now because we have existing labor laws to protect our rights. People will say, well, most people aren't knowledgeable of the law. Well, ignorance of the law has never been an excuse. Don't get me going. But you can tell. So, though, that being said, when AAUP was voted in as to be our representative, I got involved because if they're going to represent me, I don't want to be sitting at the table. So I, as a faculty member, I was involved with 2 of the contract negotiations, which was a very educational procedure, very beneficial for me because then I became an associate dean in my college, and having sat on one side of the table and now sitting on the other side of the table, I had a very good understanding of where people were coming from. The one benefit of the AAUP, in my opinion, was related to tenure. I was on the tenure committee at a time when if people just didn't like you, they could vote to not tenure you. You could have very nebulous reasons and criteria for not tenuring a person. It's not right. You know, nowadays I could have sued for wrongful firing and all of this stuff now, but again, I know the law. So the benefit, one of the biggest benefits I think of the union has been the creation of formal bylaws that are reasonable and understandable, so that if you know that you come in and you're hired and the expectations are X, Y, and Z, if you do X, Y, and Z, you should be tenured, and you shouldn't be worrying about the fact that you're not best buddies with everybody in the college, but you've done your job, you do it well, you've done what it takes. And so I think that is one of the strengths of. So the union has had a significant impact, I think, on the dynamics from an administrative standpoint. There's been just a wealth of things at the administrative level where that are kind of, I don't know, good and bad. It's like you have this, why do we need offices for like, I don't know what the name of it is exactly, diversity. I'm saying, I guess because I came from a Catholic background in Catholic schools, and respect for all human beings is something that should be understood and never denied. And I'm like, really, we have to have a whole office for this? But apparently we do. Because people will tell me situations where they feel like that office has been necessary and good. And stuff. So it's interesting, some of these things that have evolved and stuff like that. But so
listen, in looking back, what are some of your most, or give me one or two of your most memorable experiences at Wright State? Can you pick one out that's...
Oh, I have so many, but I'll share with you one or two now. I have loved working with my doctoral students and graduate students. I have had over 100 master's students and 8 doctoral students. And a lot of these people, these are nurses. And if you're sick and they're at your bedside, you are getting the most outstanding care. They are brilliant nurses. But they've decided in their career to go on for an advanced degree. In an advanced degree, you have to write. And that's something that for 20 years at the bedside, they've never been asked to write in complete sentences, to write a paragraph. And so now having to generate pieces of scholarship, like an article suitable for publication, and working with them and translating their wonderful expertise. I know one woman who has risen through the ranks in this one healthcare system, but truthfully, her ability to write when she first started working with me was, But working with them and seeing what they've done, and then they go on and they say, well, will you help me with this article? Well, sure. Now, my name's at the end of the article. I didn't do the work. I just helped them write the article. And, to get their works published and recognized. And one girl's work was recognized by a national think tank and stuff like that. So those are the people, these are my babies. You're so proud of your children.
Well, and your enthusiasm, Donna, and support are so necessary in this field to help them move forward.
Exactly,
like that.
yeah.
If you were to go back and do it all over, is there something at Wright State that you would have done differently? My
only coulda, woulda, shoulda is that I wish that Dayton Children's would establish a joint appointment with Wright State in the area of nursing research. I did a lot of work with them and collaborated with research on them, but I would have liked to have had a more formal position set up with them. That's probably my only regret. And they've said if I endow a chair for $3 million, this too could happen. And I have to laugh because I don't know where they think faculty member I don't know about you, Gary, but I don't have that much money sitting in an account anywhere.
Was that cooperative venture ever proposed by
there was another faculty member and I. We were both constantly advocating for that. I mean, because we have had other joint appointments with other agencies like Miami Valley Hospital. And so it's not an alien concept in the Dayton community, and definitely nationwide it's not alien.
Perhaps you don't want to get into this, but it sounds like a good idea. Why was it dropped, or
I don't know whether at the time whether it was financially, whether it was financially doable. It has to be
probably
financially doable on both sides, and I think that's money always seems to be the root of good and bad.
Yeah. If you were asked to describe Wright State University then, in the early days, in one word, what would it be?
One word. Wright State University versus the college, the School of Nursing. Back then. I don't know. I guess I used the word adolescent because we were
adolescent.
We were.
I was also kind of thinking, well, let me ask the other question. If you were asked to describe Wright State now in one word, what would it be?
Well, in contrast to that, we're now middle-aged. We're seasoned. Well seasoned.
I like your earlier responses in like cooperative venture. That's two words, but cooperation and so on and so forth.
You know, I'm. If you have to say what is my developmental theory that I feel guides all of my work, I'm a developmental theorist. So you know, everything is always developing, which is meaning an increase in complexity. And so when we first came, we were very rudimentary. We were just starting. We were laying the groundwork in all of the departments. We were just laying the groundwork.
That's right.
And so I didn't come in its infancy, but when I first came, it was in their adolescence, and we had lots of growing pains. Lots of growing pains. I've watched one or two times I've seen in faculty meetings where we tried to do votes of no confidence against presidents, and that was fascinating. When Jim Sayer and I get together, we have many fond remembrances of faculty senate and stuff. But you know, I think we've grown up now.
Now, refresh my memory again. I know we hit this right at the beginning. You came here first.
In 1979 to 1980.
79 and 80.
And then in 1982, after I'd had my first child, I left Dayton Children's. I'll be honest. I left Dayton Children's. I was a pretty high administrator. It was a very intense job, 12-hour day, 7-day week, on call all the time. And I was going to be the perfect mother. I was going to stay home. Well, within 3 months, I was climbing the walls. And my friends back here at Wright State found out, and they called me up. We could use a pediatric instructor. I said, when do you need me? And so I went back to teaching at Wright State. Donna Dean was an interim dean at the time because Dean Maloney had left. And she said to me, if you want to stay in nursing education, you need to get your PhD. So I started the 7-year commute to Ohio State. And so during the next 7 years, I had 2 more children and a PhD. I left Wright State from that position in 1985, 82 to 85 I worked here, because I needed to do my, what do we call it, the year you have to go full-time in your PhD.
Residency.
Yeah, I had to do my residency. Mm-hmm. And I was having another baby, so baby number 3, some small thing. and so then I came back in 1989, 1 year before I finished my my dissertation while I was here. I came back 89 full time. I worked from 89 until I retired in 2015.
Of all the deans, I notice, I recall that you haven't mentioned Dean Lancaster.
Oh, yeah.
Were you here?
Oh, yeah,
She was here.
Yeah. See, now she's in the mid 80s. So remember, I'm in and out in the 80s,
Okay.
and she was integral in that collaborative agreement set up with Miami Valley Hospital when Miami Valley closed their program. And I have a theory of, well, I give credit to Dr. Holcraft. Carol Holcraft collaborated with me on the Nursing History Project for several years. And we have a theory of cycles of leadership. And at the time when, like, Torres left, relationships with the community weren't very harmonious, let's put it this way. One of the greatest gifts that Jeanette Lancaster was building those bridges with the community. The woman, if you've met her, Southern charm, just gracious to the nth degree. Left us to become Dean of Nursing at University of Virginia, and they've named buildings after her there, and she just phenomenal woman. And she's come back to do a speaker series for us. She's very delightful. And so I think that's the big initiative that I would say that I give her credit for, is making us now accepted and desired by the community. Good job, Jeanette.
Sure.
Yeah.
That's right. Well, I really appreciate your responses to the questions today. You have a lot of historical input there that you gave, and we appreciate that. But I'm going to ask you one more.
Okay.
Is there anything that I did not ask you that you'd like to share, or do you have any additional unique perspectives regarding Wright State?
I should have thought this one out. I think I'm working on that now because, as I've mentioned to you, I am writing a monograph on the history of the college. And I am trying to come up with that, what is some thread other than the cycles of leadership, because leadership is just one aspect of the college. What is it with our students? And I think we have peppered the community. If you go into an agency now, Wright State has a significant presence as alumni, and I'm pretty proud of it. I used to walk around Dayton Children's I'd come in with a new group of students. Every floor, nurses, hi Donna, hi, and they're all going. I go, yes, I had this one. And then the instructor would come by with a group of students from Sinclair, and I go, don't tell me, yes, I was her instructor too. So it's kind of.
Donna, you are kind of moving into the archives here in a different door where you're building archival information on the School of Nursing
Correct.
and people in the School of Nursing.
Right.
Which is very good. That's
right.
very
Yeah,
needed.
we have done, I started with this with Carol Holcraft in, it's been 20 some years ago. When we got the word that Marge Stanton had died. Marge had been Associate Dean under Dr. Torres. And I thought, oh, how sad. Her story is lost. And so Carol and I started interviewing faculty, staff, administrators from the university, and any people from the community who have been affiliated with the school from day one. And so I have an interview set up with Sue Fitzsimmons, who was faculty, but then went to be the last director of the nursing program at Miami Valley, and then chief nurse officer for Miami Valley Hospital. And she just retired from being chief nurse officer of Yale Medical Center. So we've had a lot of movers and shakers that came out of the program. So I'm quite proud to be affiliated with these people. And
Well, thank you for all of the
You're
information today. Thank you, Donna.